Hey Joey Pals, it's the first Saturday in the month of June. It's June 6th. It's a few minutes after 10 o'clock on Saturday, June 6th. And we're going to have a whole series of things to get us healthier, get rid of pain, physical pain, maybe some mental pain, maybe some spiritual pain, maybe some financial pain. But we're going to have a lot of fun talking with and listening to Dr. Philip Yu. Hi, Doctor.
Hey Joey, nice to see you again.
Thank you. It's nice to be with you. Get comfortable. Come a little closer.
Okay. This is my desert mom right here.
Yes, absolutely.
So, yeah.
Okay, tell us first of all where your office is in the desert.
Yes, in the desert. We used to be in Rancho Mirage, but now we are located in the Palm Desert, right across from the JW Marriott, the hotel with the boat inside. We're in a place where it's East Hoveley and Cook Street. There's a medical plaza there. There's the VA clinic right there. So we're in that center. So once you go in the main entrance off Cook at the VA clinic building, take a left, you'll see a Dr. Ronald Bush building condo. We're right with the Dr. Bush. We are the Laser Med Institute of the Desert. You'll see Dr. Philip Yu and Associates on the window.
And you do lots of different things, and we don't want to overwhelm you, Joey Pals. We're going to go slow. We want to talk first about pain, but first of all, tell us, you've reopened your office here. How are you doing that? What are the social distancing? What do we have to wear? What are we going to eat? What are we going to tell us about opening your office?
Yeah, so, everyone's kind of sick about hearing about COVID and Corona, so I'm going to let's just call it C-19,
okay,
just for a different feel. So now that, it looks like the infection rate of the virus is not as severe as, some media put it out to be, yes, people are starting to get out of their homes, and to make it safe for our patients, we're just taking all the social distancing measures. So we're only going to take one patient at a time. You're going to wait in the parking lot, and we're going to text you when your appointment is up. If you don't have a mask, we have them at the clinic. We have the N95 masks. 95 means it blocks out 95% of particles if you happen to have a virus or bacteria. So if you don't have a mask, we could get one for you at the clinic. And then we can also make sure that you are at least 6 feet apart from the employees, and if your other patients are passing by you, because we're going to have markers in the clinic every 6 feet. We're going to have hand sanitizer at the entrance, gloves if you'd like. We have sanitation wipies right by the door, so you can wipe the door handle as you come in, or grab the door handle with the wipey. And then if you come with your spouse, you still will be seated 6 feet apart. And not because you had a spat that morning, because again, we want to maintain the social distancing. And then each patient is going to have their own private treatment bay. We have a semi-open office for better airflow. We can open both doors to get great, fresh air coming in and out. We're going to get an ozone generator to clean the air. That's why it smells great after the rain. You get the good ions that cleans the air. We're going to have UV lighting, that just like they use UV lights to kill pathogens, bacteria,
algae,
dust, mites, and we're going to have that unit in the clinic. After all, we are a laser light medicine clinic, so what better way to sanitize your office than UV light, just like a swimming pool. Yeah.
We're talking with Dr. Philip Yu. We're going to start slow, and we'll go over this a few times. Don't worry. And Joey Pals, everything will always be up on joeyenglish.com. All the things we talk about, phone numbers, websites, directions, all of that, Okay, what kind of services broadly under the umbrella of your Laser Med Institute? No, Laser Pain Med Institute. Laser Pain Med Institute. What kind of
It's
things?
a mouthful. Yeah, so, again, I'm not trying to talk about the coronavirus, but we do happen to offer the rapid test, and it's just a finger prick, and in 10 minutes it tells you if you have antibodies to the virus.
Now that means it tells you if you've been exposed or not.
Well, it not only tells you exposed or not, if you had a recent infection, which means you've been infected within a couple days, that would mean you have...
Maybe no symptoms yet?
Yes, if you have a strong immune system, you may be a carrier, you may be contagious, which means you're shedding the virus, and that's called IgM. Think about McDonald's, fast food. You've had it fast recently. And that means you should self-quarantine so you don't infect others, even if you're not symptomatic. If you are symptomatic, cough, fever, sore throat, we can provide some zinc, high-dose vitamin C, vitamin D3, just gargle your mouth and throat with hydrogen peroxide 9 times.
And I'm going to teach you about alkaline water
there you go.
As we go through this.
Yeah, and that is a part of our program. And that's how we can knock the virus out.
Yes.
So if you have IgG antibodies, that means you've been carrying the virus for more than 2 weeks or so. And if you're not symptomatic, you've developed the antibodies and immunity, and theoretically you're safe to go out in the public, okay? Now, if you have both IgG and IgM, it means you've had the infection for a little while and you're still contagious. And if you're asymptomatic, you're starting to develop immunity, you should still quarantine at home so you do not infect others, okay?
Now, do you charge for that test?
Okay, so right now, if you're a current patient, you get a reduced rate on that. The original rate, the going rate is like $119. That's what LabCorp charges for the nasal test. But I don't like the nasal swab test, because it's very uncomfortable to put a long Q-tip. You could gag in your nose or cause a nosebleed, and I don't think it's as accurate, because that can only detect if you have a colony of the virus in your nasal pharynx. Like, what if the infection was in your mouth or your throat and you just swabbed the back of the nose? You might miss it. So really, if you do both, it's most accurate, but the most non-invasive, convenient way is just a little finger prick. It's like a pregnancy test, cholesterol, very, very convenient. So
okay, let's recap. We are starting off with all the services we're going to learn about at, don't say anything, Laser Pain Med Institute. I got it right. Okay, the first thing is you can get a 10-minute test for the COVID-19. What other services?
Yeah. Oh, and that is a reduced rate of $97 just for our Joey listeners, okay? And then we also have the pain management services. We don't use drugs, injections, surgery. A lot of people that we can measure pain with our really soft wave laser therapy. What the laser does, it stimulates the body to heal itself. It's called photobiomodulation. The best way I could explain it is we all need at least 20 minutes exposure to the sun to make vitamin D3. And vitamin D3 does what? It boosts your immune system, enhances it. Oh, by the way, I'm not allowed to make any claims. This information is not meant to diagnose, mitigate, or treat any of the disorders that we'll talk about. They're for educational purpose anyways. But what I can say is this is what I would do for chronic pain.
Okay, and out here we have a lot of golfers with a lot of different aches and pains that come from golfing. So you would be a great source for that. Okay, so the COVID test, pain. Now, what's your educational background? You have a background in chiropractic?
So I got a Bachelor of Science in Health Education and Human Performance from Michigan State University.
Go Michigan.
Yeah, and so after that, I had injured my back, all right, doing a movement called the deadlift in the gym too much too soon. So I went to a local chiropractor, and he took an x-ray, and they noticed my spine was crooked because my gold chain was crooked, right? And then after he adjusted me a few months, it was straight, my back pain went away. So I became a chiropractor, and after that, I got my International Chiropractic Sports Diploma to be certified sports chiropractic physician. And then I was chosen to treat athletes at the 2008 Olympic Games, where another sports doctor had a laser, and he was getting these good results on these Olympic athletes. So I came back to California, opened up a few laser clinics, and then added more modalities like the laser-guided stem cell therapy. And we're getting
yes, I can't wait.
Excellent results. We had a couple they're from Kansas City, but they're snowbirds, Bob and Helen. So Bob had a lot of sciatic pain, low back pain shooting down his leg, didn't want surgery. So after the laser-guided stem cell, now he's back to playing golf 3 times a week. Sciatic is pretty much gone.
Oh, wow.
Helen had bone-on-bone knee pain, couldn't squat, forget about walking on the golf course up and down hills. She did the laser-guided stem cell. I'll be honest, it worked for a little while, but then it stopped working. So what we decided to use another product called umbilical cord, Wharton's jelly derived, extra vesicles therapy.
Is that like cord blood?
Well, it's called an exosome. It's a microvesicle that the stem cell releases, which happens to carry the healing messages called RNA to the target tissue, to her knee, and then her knee stopped throbbing that night, and now she could go back and play golf. Yeah.
Okay, let me see if I'm keeping straight. The COVID test, pain medication. We're going to talk as we go forward, Joey Pals, about the stem cell, because I've always been a fan of that.
Yeah.
Now, do you, chiropractic adjustments, as we think of those, do you do those traditional adjustments?
So because most of our clientele are baby boomers or seniors, a lot of them, you have to be very careful at doing a traditional chiropractic manipulation, the pretzel, the twisting. A lot of people don't like the cracking. So we gently adjust the spine through a device called ArthroStim. It's kind of like a gun, looks like a gun.
I know
it has forks and it gently taps the vertebra back in place, massages the muscle, the vibration relaxes you.
Wasn't that called a facilitator or something?
Activator.
Activator, that was it.
Yeah, but this is more, it's an electronics, so you kind of it pulses more gently. Instead of having to use your thumb, you wear it out. So that's another way I got out of adjusting with my hands, because it wore me out, my back and my wrists.
Right.
But the instrument adjusted spinal manipulation, everyone loves it. It's very gentle and effective. We also use a machine called decompression. So it gently stretches your spine apart if you have a pinched nerve.
Yes.
And we got a special one called Back on Track. Not only does it stretch out straight, if you have a pinched nerve on the left or right, guess what? It twists you on the right and the left to open up that left disc space and the right.
Oh my goodness, this is all the latest stuff. Now, do you do something, is this like a massage?
So we do have these instrument-assisted soft tissue massage or myofascial release therapy.
It sounds like it would be lovely.
Yeah, so think about like a bicycle handlebar. It's nice and curved, and we'd roll it, let's say, on your leg like this, or your back, or knee muscles, and it would gently, kind of like you are kneading dough, right? Kind of spread that tight muscle and relax it and break those adhesions up. Instead of having to dig your elbow or thumb like a deep tissue massage, it can be painful. It's a gentle way to relax the muscles. So instrument-assisted massage therapy combined with laser massage, it can be done at the same time. The laser warms up your fascia and warms up your muscles and just melts all that tension away, especially in the trapezius muscles.
That's your neck, your shoulders.
Exactly, yeah, those triangular muscles that run down the side of your neck to your shoulders.
Well, everybody's got so much stress going on right now because we've done shows, Doctor, about people living with each other 24/7 and the kids are home and maybe your in-laws are there too, and wherever they were on March 18th, they still are. We're starting to open up, but we've read and done shows on divorce rates climbing.
Yes.
Stress is terrible. We have people who have not been out of their homes in over 3 months. And that's not the human condition. That's not good for us. We're huggers and touchers and talkers. And
exactly.
We want to be together. So you can really deal, if someone has, one of our Joey pals has a lot of stress going on, you could really help.
Actually go somewhere and get really gentle, high technological treatments with our instrument assisted, our laser massage, our pulse electromagnetic field therapy, which relaxes your nervous system. And if you need to, the umbilical cord derived stem cells to gently get your body de-stressed, because when you're in pain, it puts you in a sympathetic fight or flight state,
Yes.
right? You can't rest or digest.
That's right.
So we got to relax the nervous system, get you in that parasympathetic state so you can sleep, melt your pain away, and guess what? You'll be more pleasant to your family members. So yeah.
See, you're helping to beautify Palm Springs. Now, I hear you at home, Joey Pals. Do you know a phone number for Palm? Do you know your local number here? Anybody?
So Omar, look.
760
Yeah, 760
537
537
4929.
4929. 537 4929. This will all be up on JoeyEnglish.com. Also be up on the Joey English Network, which is what I call our web pages. Do you take any insurances?
So you would have to bring your insurance, mainly your PPO, and we could give you what's called a super bill. It's basically a summary of all the services you've had and paid for, and then we'd have all the diagnostic codes, and you would submit that to your insurance company, because we like to focus on patient quality service, not fighting the insurance company, so we make it very convenient for you. So just bring your card, and then we'll give you your super bill after. It makes it easier on everybody.
We're all in favor of easy. Okay, we've talked too long, but it was easy, wasn't it? What is that gadget for next time?
So the next show we're going to talk about, because all the gyms are closed,
Yes.
and a lot of people don't want to invest a lot of bulky, expensive home equipment. This is bodybuilding in a bag.
Next time.
yeah.
Okay, the website is
drphilipu.com. So Dr. Philip with 2 L's, YOO.com.
This will all be up on Joey English. The number again, Omar, is 760
537
537
4929.
4929. Thank you. We'll get better on so many levels. Thank you so much, sharing the heartbeats. I feel better already.
Joey, it's been a blast. Let's do it again.